All right, thanks, Grant. Well, we're joined right now by Dr. Cedrek McFadden. He's our 7 News medical consultant. We're going to talk about something that's in the news a lot right now, respiratory, is it syncytial virus. We all call it RSV. That's the way we usually refer to it. And we're seeing this increase in cases for this potentially deadly disease all over the country. So, Dr. C, what are the first signs people should look out for when it comes to this?
Well, I want you to think about a common cold. The symptoms that you might see, such as a runny nose, nasal congestion, or even fever, those are going to be the initial signs or symptoms that you may see. And in children, it can lead to trouble where they don't wanting to take in food, take in a bottle, because they're having such trouble breathing. And we really get more concerned when they have other signs or symptoms, such as wheezing, or even they're using what we call the accessory muscles, the muscles in the neck, the muscles in their chest, to try to get those breaths in. So they're struggling even more. That's when we call the doctor. But again, think common cold, what we've seen over the years, and even with COVID.
So a lot of us think of RSV and I remember back in the day when you had little ones, you were so worried about little children getting it. But is this just a child illness, or can everyone get it?
Well, it's not just a childhood illness. There's probably risk with all of us, right? But there are people who are at higher risk. Primarily, we're talking children that are under 6 months of age, children that are born premature, or those that have other health problems, and those who are older, or people who have medical comorbidities such as the heart disease, the lung disease, that makes you at higher risk. But again, by the time a child is probably 2 years old, most of these children have already been infected with RSV at some point, but we all are potentially at risk here.
And how do doctors typically diagnose it?
Well, there are certain nasal swabs and blood confirmatory tests that you can do, but this is an illness that the doctor may not need an actual diagnosis, because you're going to treat it the same way. You're going to treat it with supportive, making sure you're getting adequate hydration, making sure that the child can eat, and in cases where they can't, sometimes it means you got to get to the hospital or get some fluids through an IV. There are no particular vaccines available for this, but it's supportive. So it's giving steroids when you have trouble breathing, inhalers, and things like that.
And when it comes to contagious and how contagious it is, do we really need to be concerned? I mean, is this something that's going to spread through the schools or amongst family members?
Well, it is quite contagious. We know that close proximity, which is why we're seeing higher numbers now, as more people are back at work, more people are back in school, that encourages the transmission of this. I mean, just last week alone, nearly 10,000 positive tests came back in South Carolina alone. So, doing the